there are growing concerns over the health condition of the Minister of the Federal Capital Territory, Abuja, Nyesom Wike, following the report that he has been diagnosed with congestive heart failure and that he is currently under medical management in the United Kingdom. Nyesom Wike himself was last seen on September 3, 2025. That was Wednesday, September 3, 2025, during the flag off of the emergency rehabilitation and dualization of the Caro Interchange, Custom Clinic Road Junction, Abuja. That was the last time he was said to have been seen in public. Now, it was the Sahara Reporters who on September 11 published a report claiming that the minister had been diagnosed with congestive heart failure and that he is currently under medical emergency in the United Kingdom. Now, it has been 3 days now since Sahara Reporters dropped that report, and there has been no reaction from Nyesom Wike, the minister, or his aide, Lere Olayinka, who are known to not take those kind of reports unresponded to. That it has taken them this long to react seem to give credence to the report by the Sahara Reporters. And that's why there is a growing concern and all kinds of speculations out there about his state of health. But what we do know was that he was last seen on September 3. And again, he has been represented since that time. On September 4th, Thursday, September 4th, his chief of staff, Chidi Amadi, represented him at the flag off of the distribution of fertilizer to farmers in the Federal Capital Territory, Abuja. And on the September 11, he was represented by the Minister of State, Maria Bankure, during the conference of Association of Pediatric Surgeons of Nigeria during their 24th annual general meeting and scientific conference in Abuja. The minister ought to declare that conference open, but he was not there. He was represented by his media, by the deputy, by the Minister of State, Maria Bankure. Now, according to the report by Sahara Reporters, the Sahara Reporters allege that doctors had earlier recommended that because of his heart condition, that the minister should undergo bypass surgery to address the problem. But it was, according to the report, rejected by the minister because the minister is said to be concerned that if he undergoes such bypass surgery, it will keep him away for a long time. And keeping him away for a long time could also lead to his replacement as minister. And that because of that concern, he had avoided bypass surgery. In other words, the paper is claiming that the bypass surgery was avoided because of the nature of his job, because of his job. He don't want to lose his job. because he could be replaced if for extended period of time he was not seen, okay, on his duty post. That's what SaharaReporters is claiming. But what is really of concern to those who are watching the situation was that Lere Olayinka, who is always cantankerous and always very responsive in replying such report, has remained silent in the last 3 days. And there was nothing also from the minister himself. That has raised a lot of concern about his health and appears to give credence to the report by SaharaReporters. Because if you understand Lere Olayinka, his special advisor on media and communication, he is somebody that easily responds. The last time such a report came out about the minister's health, he quickly debunked it, and the minister himself soon after debunked it too, came out. Okay, but this time around, they have not said anything, and that is why there are a lot of speculations going around about his state of health. And if you know the minister, I don't know Minister Nyesom Wike personally, but I know him historically. If you know Wike is somebody who, if he's around, he would have tried as hard as possible to prove SaharaReporters wrong. And Lere Olayinka would have been out there challenging it using his X handle or whichever platform he wants. But interestingly, Lere Olayinka has left this issue that had been of concern to a lot of people and was mocking the former Minister of Transportation and former Governor of River State, Chibike Amechi, saying that he said that he's hungry, but they are cooking rice in Lagos by this Hilda, this Akwa Ibom lady that is trying to break a record, world record, Guinness World Record. Okay, they are cooking rice in Lagos. So why is it that Amechi is not in Lagos? That since he said he is hungry, of course, it doesn't make sense because the truth of the matter is that even the rice that they are used, the elder was cooking in Lagos, a bag of rice is today more expensive than it was when Tinubu took over in 2023. That's a fact. No matter how anybody is telling you now that the price of the rice is coming down, price of the price of rice is still higher today than it was under Buhari. And we're not talking about under Jonathan, under Buhari. So while his duty post is left unattended to, because this issue has to do with the state of health of the Minister of the Federal Capital Territory, Abuja, who is like the de facto governor of Abuja, appointed by the president to help him oversee the affairs of the Federal Capital Territory, Abuja, because the president constitutionally is in charge of Abuja. The president is like the governor of Abuja, but he has ceded that position to the Minister of the Federal Capital Territory, Abuja, who signed certificate of occupancies on his behalf. That somebody like that is said to be having serious heart problem in UK and the under management and has not been seen since September 3. What should have been the Lere's concern is to be able to convince Nigerians that his boss is okay, that there is no truth whatsoever in that report. But his silence and the minister's silence has now generated all kinds of speculation about the state of health of the minister. But one thing is clear. The minister was last seen September 3. Last seen September 3, 2025. And for a minister who is an active minister, who is one of the reference points of this administration that they claim they have done well, look at what Wike is doing in Abuja, and he has been out of circulation. It means people are genuinely concerned about his state of health, and not the least of which is even people of River State also, where he's a major player as preparation heightens about the potential return of Governor Simi Fubara and the State House of Assembly that were suspended following the declaration of state of emergency in that state. I don't know what to think about this growing concern about the health of the Minister of the Federal Capital Territory, Abuja, and why he has kept muted on reacting to this report, including his special advisor, Lere Olayinka, who instead of addressing this serious matter, seemed to be playing to the gallery by talking about Chibike Rotimi Amechi. Whatever is your position, let's hear from you at the comment section. Thank you for watching this video, and if you are new to my channel, you have not yet subscribed to my channel, please subscribe to my channel, hit the subscription button, hit the notification bell. When you subscribe to my channel and hit the notification bell, anytime I have a new video, you'll be among the first to know. God bless you. And please don't forget to like this video, because when you like it, God will rank it high and recommend it for more people. Thank you, and God bless you and yours.